So let's go forward with Chai Chuah. So that's another impressive country which has done an impressive healthcare transformation in New Zealand. I'm still remembering a very well tight cooperation with my dear friend Chai Chuah. He will touch and envision the future of healthcare post-COVID-19. He is the former Director General of Health, Chief Executive Officer of Ministry of Health of New Zealand. And he is the founder of Healthcare System Transformation Limited. Dear Chai, thank you for your time and your support today. I know it's very late at the other end of the world. Even it is very, very late, you're with us here. Please share with us your view. Chai, thank you very much. It's your stage.
Can you hear me?
Yes, I can hear you.
Yeah. First, I just want to thank you as the president of GCCCF and your organizing committee for inviting me to deliver this keynote address to your forum. It's been very interesting for me to prepare for the forum, and I'm now going to share with you a number of slides, which is really an memoir for me as I sort of talk you through this particular theme around, so what does the future of healthcare look like in a post-COVID world? So I'm going to share the screen with you now. Okay. Can you all see the screen?
Yes.
Okay.
Yes.
Right. So I'm going to start off with some opening remarks. When we think about the future of healthcare, it's not a destination. It's more like a journey. So if we look at healthcare in the last 200 years, we cannot help but to think about the tremendous progress it has made. But those of us who have been in healthcare, particularly in the last 20, 30 years, there is a sense that the momentum has slowed. And in many jurisdictions, COVID-19 has exposed the flaws in many of our health systems, and as more and more health systems come under pressure. And one of the fundamental reasons why COVID has exposed those flaws is because the changes that is affecting our health system is exponential and is becoming more complex. But the way that policymakers and decision makers have chosen to respond to those exponential change and complex change has been linear and simplistic. So we have to make the transition. So a transition to the future of healthcare that we want is going to be hard, but is necessary and is achievable. And in the talk I'm going to give you is I'm going to suggest that the transition requires a dual transformation approach where we have to shift from an emphasis on rescue and acute treatment to well-being and prevention, and actually addressing the broader determinants of health. And I will finish my presentation by just looking specifically at a number of significant chronic conditions like stroke, dementia, cancer, and then lastly, I will address the very present issue of COVID-19. So if you look at the 21st century in terms of context and environment, these factors that are put up have been accumulating for some time now. So we have rapid technology advances, and some would say it's almost like godlike technology. The economic models that the free world is built on has created so much uncertainty. And with demographic changes and the issue of climate and physical environmental impact that is giving rise to extreme weather and natural disasters. And some would argue that the pandemic, hence COVID-19, and wars and conflict is because of the way that our context environment has chosen to actually run the world. So as a result of all these things, 21st century life is under significant pressure. So in general, you can get a sense that there is a developing distrust of mainstream institution. There is stress, anxiety, and loneliness among quite a lot of people, both young and old. There is increasing evidence everywhere we go, no matter how rich the country, of homelessness and poverty. And the issue of the health gap is part of the driver, but it's not the only driver. We see evidence of substance abuse and violence and crime. And the fundamental reason for that pressure is because the changes that we are facing is exponential, as this graph is showing, but the response that all policymakers and decision makers, whether they are in public sector, private sector, politicians, professionals, unions, et cetera, is linear. So we can see that as a result of these two quite different trajectory, there is a gap opening. But mainstream institutions have chosen what I call a patchwork of responses. So if you look at this particular diagram I put up, the usual responses sort of hinges around, we need more resources. We need to work on accountability and perhaps better levers. We need better structures. We need to focus on quality. Perhaps better integration would help. Or let's focus on productivity, efficiency, or reducing waste. Now, none of them are particularly wrong. It's just that it is still a linear response and is insufficient to actually meet the gap that's opening up because of the exponential change. Now, I put up some examples of reports from New Zealand, from Canada, from Australia, of the kind of reports that prepared for government of how they should actually address this issue facing our society, particularly in the health system. So if you were to look at all those reports and then ask the question, but why is it not making progress? What's getting in the way? What I'm putting up here is some of the things that I've observed. What's getting in the way is the tyranny of the urgent. So a lot of our colleagues are dealing with the here and now, right? They're looking for the silver bullet. They're generally quite risk averse. The mindset is quite closed. And generally, when they don't get the progress they want, they will look for someone to blame. And a lot of our leaders are not looking up. They're not looking around, and they're certainly not looking far ahead. And it is also my observation that too many of the people who we rely on to lead us have actually stopped learning a long time ago, right? And they run obsolete institutions. They are practicing obsolete leadership model. And generally, the value is more about self rather than about teams. And there's lack of courage, and there's more about fear, and big egos dominate our landscape. And the very important issue around addressing this culture of fear is we pay lip service to those cultures. And it is not difficult to find wrong values that drives our system. So those are some of things that sort of explain why, despite all those reports that are prepared by multiple governments, we don't make progress. So as a result, in most healthcare systems that you look, these three elements signify widening gaps. And every one of those three elements, affordability, access, and equity, with each passing week, month, and year, it becomes bigger, and the gap is even bigger. But then, of course, COVID-19 arrived, right? So it is characterized initially as a health crisis, but we now know it has got broad social and economic impact. The interesting thing about COVID is there is a little bit of a silver lining on this, in that it has actually opened the door and accelerated some what I call stall technology. So if you look at some of the examples I put in here, some of this stall technology, they have been trying to actually get a foothold and make more substantial progress in our health system, like digital telehealth, COVID tracing, and developing of apps, and the use of artificial intelligence, robotics, and other autonomous platforms. The genome sequencing of the various the variations of virus, it's a great boost for genetic medicine. So what we're doing in terms of virtual workshops and conferences, telecommuting instead of people coming to work. But COVID-19 has also crippled, if we're really honest, the broader health service. Even in New Zealand, virtually all other health services are taking a back seat and have been deprioritized to respond to COVID. And in that regard, I think it has exposed and exacerbated the flaws that we're seeing in all health systems. So I want to turn to the future of healthcare. And I thought I'd put the graphics up here around what the future might look like. So this is a drawing that I did, Mr. President, about 2 years ago when I was sitting on the beach somewhere. So I thought I'd share it with you. So when we look at the future of healthcare, there is a giant iceberg. And this particular slide shows that it is very tempting when we talk about future of healthcare to focus just on health services. But what sits underneath, and I've deliberately put the words upside down just to make it harder for people to look at, is because what sits underneath is probably more important for us to address as we look at addressing health services. So the issues around culture, social issues, environmental and economic determinants. If we address health services without addressing all this that sits underneath the sea level at the bottom of the iceberg, then the future of healthcare would have failed. The second thing about the future of healthcare is that we are facing a very common term that's been used, is what it's called the silver tsunami. So when you look at any developed health jurisdiction, and I'm using New Zealand and a few other developed countries as an example, 15% of New Zealand's population is age 65 and above, but we consume over 50% of the total health expenditure, and not all the way by any means actually is good use of the funding. The 2017 OECD report, I would recommend for those of you who are listening in to read that, because it amongst other things, it explains about when we look at the metrics of the silver tsunami, it's not just about the percentage of people over 65, but it also reminds us to actually look at the velocity of aging, how fast a population is aging. It reminds us to actually look at the OH dependency ratio. And it reminds us that, addressing the silver tsunami, right, is so important because it is not just going to impact on health. It has got broad social, cultural, economic impact. And the little arrow I put underneath is a very helpful categorization that's commonly used among the community that talks about an aging population. If your population has got 7% of people who are 65 above, you're called an aging population. If it's in 14%, it's an age population. 21 is super age. At 28%, it's called ultra super age. Now, actually, the established definition kind of ends there. And I've added on the last one, and it's a creation of mine. It's because by 2050, there are half a dozen countries, right, where more than 35% of their population will be over 65. So I've coined the word mega ultra super age population. So I think it just emphasized that, you know, we are starting to see the effect. Say even in New Zealand, where we have 15% of population over 65, we're starting to see the impact of it, not just in healthcare, but in government policies around superannuation, the retirement age, and so forth. So if we're going to address the iceberg and going to address the silver tsunami, we have to accept that in the future of healthcare environment will be characterized by these things. The pace of change will be fast. The change environment will be ambiguous, right? And the environment will also be very fragile and volatile, and it will be constantly shifting and changing, and there will be great uncertainty, and all those issues, when you combine them all, are complex. So the situation doesn't lend itself for us to continue to try and run future healthcare in the same old way. So let me come to what I think the key themes of what future healthcare will need to have. First of all, the first theme is that future healthcare will need to be personalized to individual, and it needs to be precise. So people use the word personalized healthcare and precision medicine. The second theme is future healthcare will also be earlier, will be closer, and it'll be smaller. Right. And the reason for that is if you kind of look at where genomics science is going, we will need to actually look at the issues of intervening much earlier, going right back to molecular level, much closer because it will be personalized, and much smaller because we actually have to intervene not when a tumor grows, but actually addressing the cells is actually grows to that. The other theme that kind of fits in with this particular forum is the big emphasis on prevention and well-being. And we need to look at the term prevention and well-being in the broader context, well beyond just health services. We have to look at that underneath the iceberg to look at the social, the cultural, the economic, and the environmental determinants. And last but not least, and I think that this is a lesson from other economies, other sectors, healthcare, future healthcare will need to be consumer-driven. So a good place to start would actually be the new generation of of the elderly, which are the baby boomers. People like myself, I'm 62 this year. So people like me coming along, we will demand more. We will expect more. And we won't be like the silent generation of our parents, where we sit back and we accept whatever is given to us. So we want to have greater ownership, greater say in the choices that's available to us. So these are the four big themes of future healthcare. But future of healthcare has also got to solve these four issues. If the future of healthcare doesn't solve these four issues, then it runs the risk of being stalled. The issue of security, the issues of privacy, the issue of equity of access, and the issue of affordability. Increasingly, all these issues become more and more important if we want to actually look at a more rapid movement towards future of healthcare that's sustainable. Right? Because if we don't address the issue of security, privacy, we won't get trust. If we don't address the issues of equity of access and affordability, we're going to leave a lot of people behind. Right? And the future of healthcare, we can't actually do that. So the way we make the transition to the future of healthcare from where we are is to embark on what I call a transformation journey, where you actually have to do two things concurrently. You have to improve the existing, and you have to create the new. And the momentum of doing both those things together is you initially start by a big emphasis on improving the existing, but you also have to start by creating the new, small as it may be. But as you move on that transformation journey, you start to see that shift where the two parts become more equal. And as you mature in the transformation journey, the new part becomes more dominant than the existing. But to embark on the new transformation journey, it has to be anchored on a very clear statement and understanding of purpose, of vision and mission. And those are just not fuzzy words, because those words need to be meaningful enough so that you can develop a coherent strategy with an accompanying implementation plan. Then the strategy and implementation plan can only be executed if you have developed an appropriate target operating model, right? So, and I'm going to dwell on the operating model because this is probably one of the hardest thing about executing the transition, because most jurisdictions will be very tempted to just pick some of those 12 elements and work on it. You cannot do that. To execute the coherent strategy and the implementation plan, you have to execute all 12 elements of the operating model, and all the 12 elements have got to be interrelated. Now, I've highlighted culture and leadership and technology because I want to spend the rest of my time just talking about why those three things are really important. Culture is like a foundational thing, right? If the culture is wrong, everything that you built on it is built on shaky grounds. So for future of healthcare, one of the aspects of culture, it needs to be values-based. And the values need to be service above self. I'm getting some feedback here. The second aspect, I think, is the culture needs to value teamwork above individual health itself. The culture needs to emphasize on diversity of thoughts and talent. And the culture also needs to be about making decisions and not just, so in New Zealand, there's a saying, we spend far too much time talking and not enough doing. So the culture needs to be about delivering and about executing. And we need a culture of learning. And the reason for a culture of learning is important is because that environment I talked about is constantly moving and changing. So we have to keep up with that. And the only way to keep up is to continue learning. An important aspect of the culture also is about learning to own the challenges, the success and the failures. We have to abandon this culture where we always blame somebody else when something goes wrong. Right? And it's about being open to new ideas, open to criticism, opening to other perspectives and viewpoints. And last but not least, it needs a culture where we are comfortable with an environment which is volatile, uncertain, complex, and ambiguous. And I like to emphasize leadership because there's another saying that I like, which says that you can have the best strategy in the world, you can have all the funding in the world, and you can have the best tools in the world, but if you don't have the right leaders, none of the other three matters. And in the future of healthcare, we need leaders who will live and support and develop the culture, because this is like building the foundation. And we need leaders who are fearless and who are courageous enough to step outside the comfort zone and be courageous enough to accept responsibility when things don't work. And we need leaders who are comfortable to lead from the front, but also comfortable to lead in the middle and comfortable to lead from behind, right? And the reason for that is because at times we need other people to lead from the front and we need to step back. And this is kind of important because the leaders in future of healthcare need to know how to arrive in their role, how to stay in their role, and when is the time for them to leave. Most leaders today do not know how to leave. They like to arrive, they know how to stay, maybe, but they know how to leave. In the future of healthcare, leaders need to know when to leave. The other aspect of leadership is to learn to have a strategic conversation and an excellent communicator. The strategic conversation, I don't know whether you have been in meetings and conversation before where you realize there's a lot of words being spoken, but actually it doesn't mean anything and it doesn't lend itself to advancing the agenda. And the reason is because the conversation is not strategic. The other aspect of leadership, the kind of leaders we need, is also leaders who are very disciplined and who are very focused on what's asked of them. And the ego management is very important because, if you are a successful leader in the future healthcare, you will have an ego. And so will the rest of your team. The challenge of the leadership is to learn how to manage those egos and not let that get in the way. Resilience is important, and because of the uncertain environment, the constant changes, the potential that some things we do might not work, and potential that we might have to accept, things may take time. It requires us to be patient. It requires us to be resilient. Number 9 is very important because, especially when we are in an age where we are having godlike technology, learning how to be compassionate, learning to be more human and to be humane is a prerequisite for leadership in the future of healthcare. And finally, we need to be respecting that we need a team of leaders, not one charismatic leader. And I'll put down that if you're looking for a team of leaders, you want in the composition people who are good strategists, who are good visionaries, who are good networkers, but also people who can implement. And you need all 4 of them. And in technology, and this is my last of the element of the operating model, is this particular book I like because this is a second book by Klaus, where he has refined and clustered the 21st century technology into these 4 headings. Now, I won't actually go through that because you can read that. But the point I put underneath there is quite important. As we develop more godlike technology, we need to become more human and humane. So, Mr. President, the quote that you quoted from me earlier is consistent with this theme. So I'm now going to now look at some case study quickly for you. So if you look at the journey ahead, where do we start in future of healthcare? Well, a very good place to start is to look at the issues of the silver tsunami, in other words, the aging population. And if you look at the typical things that an aging population face, we are very familiar with stroke, dementia, and cancer. But of course, with COVID-19, it also disproportionately affects the elderly. But what is very interesting, though, it has actually almost sidelined all these 3 things. And, the emphasis on COVID and all these other things have almost been pushed aside. But if you look at why we need to look at all these elements and not just focus on COVID, is because, Mr. President, some of your organizations are focusing on stroke. There are 15 million people who are diagnosed every year with stroke, 5 million die, 5 million are disabled, right? If you look in Europe in 2019, this is costing Europe 60 billion euros. And when you kind of look at what are the risk factors, sitting at the very top is hypertension and AFs. But in terms of how we address this massive problem is the point that was made in the opening address is to shift the emphasis from looking at acute intervention and treatment towards prevention and towards well-being. Now, my last point there, if you kind of look at the things that will make an impact on the prevention and well-being, are things like genomics, the early and continuous and inexpensive 24/7 monitoring, and early intervention on the broader determinants like lifestyle. If you look at dementia, dementia has even got a scarier number. Dementia, there are currently 50 million people around the world with dementia. It will rise to 75 million by 2030. And in the US alone, it's costing them 818 billion. In 2030, it will be 2 trillion. And some of the major risk factors is it is effective aging, but it's also genetics, it's also lifestyle. But the current focus on dementia is largely looking at dementia as a disability and is focusing on the medical model of dementia. It needs to shift towards much more around prevention and well-being, just like stroke. And the future of healthcare for dementia has got to emphasize on connections and meaning for the individual and the family supporting the people with dementia. There will be opportunity to look at issues of genomics, the monitoring and screening, but also the use of smart technology. Cancer is another big chronic disease. There are 10 new cases a year. It will rise to 20 million in 17 years. In 2017, it costing the US 400 billion, right? And the major risk factors, again, is age, genetic, and lifestyle. So there is consistency with a lot of those previous two conditions. But the future healthcare, like the other two, need to move away from the focusing on acute treatment towards prevention and well-being. And again, technology will help in terms of cancer, just like the others. And I want to finish off by just talking about COVID-19. So if you were to look at the stats, it's not very encouraging. And in fact, some of us are so numb to the numbers, right? So there are 46 million cases and 1.2 million deaths of 2nd November. 8 out of 10 people in the US who are dying are 65 and above, in other words, the elderly. So COVID-19 currently is characterized by waves. So in the Northern Hemisphere is now getting subsequent waves. So people are looking at lockdowns and what's beyond the lockdown. And 2021, I can almost guarantee you, will be dominated by the discussion around vaccination and better treatment. Right? But it's also impacting on people's lifestyle, on social interaction, economic activities, and cultural changes. Just look at our conference today. That's, we're doing it for the first time for many of us. Right? But the current COVID-19 response in the context of the future is we have to move from being responsive to recovery and planning for the next pandemic. Because there are already thought leaders, they are saying we need to look at the lessons and the linkages of COVID-19 as a dress rehearsal of what is coming, which is the global impact of climate change. If you look at how disruptive and how linear our approach to managing COVID-19 and how it's disrupted almost everything we know globally, well, I think that the global impact of climate change will be more significant, it will be even greater. So I think that the faster we look at the lessons learned from COVID-19, it may give us put into a better position to actually address the issue of climate change. 2 more slides, then I'm finished. So I like this particular statement from Klaus. He is the founder of World Economic Forum. This is in his first book. So he says the changes are so profound that from the perspective of human history, there's never been a time of greater promise or potential peril. My concern is that decision makers, and I put bracket leaders, are often too caught in traditional, linear, non-disruptive thinking, or too absorbed by immediate concerns to think strategically about the forces of disruption and innovation shaping our future. And I'll finish by giving you this quote that I love from this book by Dr. Atul Gawande, who for some of you will be very familiar in his book, Immortal. In the epilogue, he writes, "We have been wrong about what our job is in medicine. We think our job is to ensure health and survival, but really it is larger than that. It is to enable well-being, and well-being is the reason that one wishes to be alive." So thank you very much for the opportunity. I'll hand it over back to you, Ms. President.
Thank you, Chai. Thank you very much. I still remember our working together in New Zealand, my visits there, and I was very impressed how, from this leadership perspective, what you showed up to be open, to generate trust, to not too much show, not too much ego. And when you showed these 10 points, I really saw you there. So it's really a pity that you're not anymore there, but you're still active in this area. And one important aspect, and you know, we had a lot of discussions about that, is the word trust. So I think one aspect is to generate trust. And what would be your advice to the new leaders, to the leaders today, how to gain trust? And trust in the definition is the acceptance of vulnerability. So how we can make people to accept their vulnerability, to trust in healthcare systems, to trust in leaders. What you will be your advice, how to start to do that? Because I think this is the biggest, let me say, the biggest challenging aspect here.
Yeah. So I will answer that question, Lupo, by giving you a story of something that happened to me in real life, right? So when I was a chief executive running an area health board, my chairman said to me, the community doesn't trust you. And the reason why they don't trust you is because you always hold your meeting on your terms. In other words, I always get them to come to the hospital or to the offices, this sort of stuff. So he said to me, if you want to gain trust of the community, you have to go to the community. That's one. Secondly, when you go to the community, you are not there to make statements and ask them to do things. You're not there to explain about what your organization does. You're there to ask them questions about what matters to them and what are the things that keep them awake at night. And then the next step is they would like to know what you're going to do when they tell you these things. And they will want to expect from you that you would not just listen, but you want to demonstrate that you are courageous enough to at least do one thing that they have spoken to you. If you go to them, you listen to them, but you do not do anything, then it is not possible to have trust. So I think it was a very sobering experience. I think we can extrapolate a number of principles from that, but I think I'll just leave that for your audience to just think that through.
Thank you very much. And I need to emphasize here that, and you already said it, this is the first time that I only see the speakers. I don't see my complete auditorium. We are now around 700 people online. I don't see them. It's a little bit strange for me, but still we need to be able to generate the trust to do our presentation and to go forward. And thank you very much, Chai. Please stay in the line. And I see here a question. What is the biggest gap in healthcare systems, by your opinion, especially now during the pandemic? The biggest gap in healthcare systems, especially now during the pandemic? That's the question from the internet.
Yeah, so I think that the biggest step I see is, which for me felt very, very strange, is everywhere I look, even in New Zealand, right, we seem to have abandoned all the other services and put all the emphasis on COVID-19. It is as if mental health, cancer, stroke, dementia have all disappeared overnight. And I think what we are going to face very shortly is when we are getting to a position where we feel that we've got COVID-19 under control, we're going to have a massive problem with the failure of health system in not being able to handle all these other issues, which were significant issues before COVID-19 arrived. But for some strange reason, without exception, based on the countries that I've looked at, seems to have been relegated not just to a second place, but to a third, fourth, and fifth place. And I think, I just don't understand that.
Yeah. So there's another question. Do leaders need to regularly gather themselves to change the healthcare systems like COP21 today, or the environment? Or have you or other examples to suggest happen the healthcare systems?
So can you repeat that?
So do leaders need to regularly gather themselves to change the healthcare system? This is one question. So do leaders need to regularly gather themselves to change the healthcare system? That's the question.
Yeah, so I think that what leaders need to do is, one thing for sure, is that if they are just managing status quo and not changing enough, I think it's a signal that they're not doing enough. Mm-hmm. So, you come back to the point I was making around the dual transformation. Every leader in healthcare who wants to make an impact, right, needs to do both. In other words, they need to be looking at the existing thing that they do and think about how to make it better. Now, make it better can also mean that you actually stop doing some stuff, right? Mm-hmm. But actually that is not enough. You actually have to actually do something new. And that something new is completely different from improving your existing service. So the short answer to the question is yes, but the yes is in two parts. You have to do both.
Mm-hmm. So the last question for you now: how can we build a sustainable data-driven healthcare ecosystem? So my team is bringing me the questions. So this is, I think.
Okay. So the question is, how can we build a sustainable data-driven healthcare system, right?
Right.
Yeah. So I think that part of the operating model I talked about is the focus on the management of information and big data, right? So for those of the audience who are very involved in the sphere of information technology and data management and big data analytics, et cetera, so the thing I would say about it is it's going to be a very important part of the future of healthcare, but it can only play its usefulness if it is connected with all the other things. So a lot of the time that I see when I talk to people who are passionate about this agenda around data is they almost pushed the whole issue of data ahead of everything else. Just as people who are passionate about workforce, just people who are passionate about quality or safety, they push those individual silos. So for data to play a bigger role and be more sustainable, the champions of the data part of the sector, if you like, need to think about how to connect with the other aspects in the operating model.
So, and I think I'm also very convinced about that is, so we have a lot of technology around us, a lot of new innovations, which is good and will be always, again, more innovations. But it's about the people who control this, who define the strategies. So it's all about people. So it was like that in the past, and it's still like that now, and it will be still like that in the future. That I think every best technology can only work if the human beings have control about that and have the right strategies for that. Is it so in summary how we can look at that, Chai?
Yeah, look, I think that, and that's why I put the statement underneath one of my slides, right? So I think there is no question that technology will become much more advanced. As part of technology, the whole issue around the use of data, the significance of that. But I think that as we accept and learn how to incorporate those things into a future healthcare system, right? One of the things we need to think quite hard about is to not forget the issue of the human touch and about being more humane. And the basic example I can give you in the practical terms today is I just cannot understand, like right now with COVID-19, that we have actually lost our humanity by actually locking up and locking away our elderly, either in their homes or in facility, and denying them of being supported by their loved ones and their families. Right? And there is to me, it is so very wrong. So in that regard, I think that what has happened, in terms of future healthcare is right now, COVID-19 have shown us that we are faced with an existential challenge like COVID-19. We have somehow forgotten humanity and excuse that by saying, oh, but we're trying to keep the elderly safe.
Yeah.
Right? I think that's wrong.
Chai, thank you very much. Thank you, and stay with us. And I will need you also for some more question. I know it's late in New Zealand. It's 10 hours ahead. So thank you very much.
Welcome.
And also you will get also the questions also later on, so we cannot touch every question.
Sure. Just send me the questions.
Okay. Thank you very much.
Okay. Thank you. Welcome.